So now we shall discuss about each and every sulcus and the groove which we have on the external surface of the brain, right? But before that, first of all, we have to discuss one very important thing. It is just a basic for you, just remember that, because later on we will discuss in much more detail what will happen if so and so structure is damaged, okay? So now what I am going to discuss with you, just introductory point, is that which surface is supplied by which artery. For example, let us say that if I am drawing a line in the center over here, all the way like in this way, like this, right? Now if you can very clearly see, guys, if you can very clearly see, let me highlight this. Yeah, you see this part which I am shading right now, right? So this part which I am shading right now is entirely supplied by an artery that is called as anterior cerebral artery. Okay, so we have got three cerebral arteries. One is called as anterior cerebral artery, another one is called as middle cerebral artery, another one is called as the posterior cerebral artery. Out of these three, the largest blood supply is given by the posterior cerebral artery. So here this part is given by anterior cerebral artery. On the left, on the right also the same, anterior cerebral artery, the same thing. Okay. Next important thing is that if you can figure out this part over here, right, I don't know if you can very clearly look at this, but this part which I am shading right now, okay, let me use this thing here. See this part which I am shading right now, right? So this part of the cerebral hemisphere is supplied by your middle cerebral artery. Okay, it is supplied by your middle cerebral artery. After that, the rest of the part in the sense, see this entire part like this. The remaining entire part, this entire part is supplied by the posterior cerebral artery. Okay, so how many things we have got here? We have got something called as anterior cerebral artery, right? So this is supplied by anterior cerebral artery. Next, this is supplied by your middle cerebral artery, and this one is supplied over here by posterior cerebral artery. So there are three cerebral arteries, anterior, middle as well as the posterior. So this is what I was telling you, that this part of the cerebral hemispheres are supplied by the anterior cerebral artery, and next this one is supplied by the middle cerebral artery, and this is supplied by the posterior cerebral artery. So when can middle cerebral artery be ruptured? I have already told you that there is some problem called as extradural hematoma, if you remember, or extradural hemorrhage, the hemorrhage which will happen outside the dura mater. That time what will happen is that this middle cerebral artery will be ruptured. So when the middle cerebral artery will be ruptured, patient will lose consciousness for a transient amount of time. It means for just let us say 15-20 minutes, and again he will regain back his consciousness and he will head towards the emergency department, right? So this way of losing the consciousness and again regaining the consciousness back, so this is called as lucid interval. So lucid interval is mainly seen in case of extradural hemorrhage, right, where the middle cerebral artery is ruptured. Now what we shall do is that we shall discuss as usually what are the structures that are located on the lateral side, right? So lateral side we have got some sulci and all. So let us see what are the different kinds of sulci we have got, what are the names and all, and what are the gyri, everything we will discuss now, okay? So let me draw this structure over here. Right. Anyways, this is just a rough picture, okay? And in this picture, what is one of the important thing which you can find it out, guys? So here, what is one important thing you can find it out is that you see this notch. I have already told you that this pole is called as the frontal pole. Okay, this pole over here is called as your temporal pole, and this pole over here is called as your occipital pole. So frontal pole, temporal pole and occipital pole. And exactly the point where the frontal and temporal are meeting, you see this notch over here, right? So this is also called as a stem. What is this name? This is called as a stem of lateral sulcus. Stem of lateral sulcus, stem of lateral sulcus. Now this stem of lateral sulcus will divide into 3 branches. Branches are also called as what? They are also called as rami. So this stem of lateral sulcus will be divided into 3 branches. So let us see what are those 3 branches over here. Okay. So for example, this stem of lateral sulcus will divide into a branch which is coming front. So can I call that this is an anterior horizontal branch? It is horizontal and it is going towards the anterior side. So anterior horizontal branch. Next, there is a branch that goes onto the top in this way. Okay, so let me do it. Yeah, there is a branch that goes onto the top. So can I call this as an anterior ascending ramus or anterior ascending branch, ramus, or I can also call it as a branch, right? Now, branches are called rami. And next we have got another that is going all the way like this. So this one is called as posterior rami. Okay, so we have got 3 branches. Okay, the stem of lateral sulcus is giving rise to 3 branches. What are those 3 branches? One is called as an anterior horizontal branch or anterior horizontal rami. Another one is called as an anterior ascending rami. Another one is called as a posterior rami. Okay, so let us write down all those 3 rami over here. Okay, so what are these rami? See, this rami over here you call it, this rami over here you call it as anterior horizontal ramus. Okay, after that this ramus over here you call it as anterior ascending ramus, anterior horizontal ramus, anterior ascending ramus, and this ramus over here you call it as posterior ramus, right? So why it is called posterior? Because it is going on to the back. Why it is called horizontal? Because it is horizontally projected. Why it is called ascending? Because it is going up. Okay. Now if you exactly see, this is which is not important actually, but if you exactly see that anterior horizontal ramus is around 2.5 centimeters. Okay, it is somewhere around 2.5 centimeters. And next, when it comes to anterior ascending ramus, this is also 2.5 centimeters. Now compare these two with the posterior ramus. Posterior ramus is a little bit lengthier, it is 7 centimeters. Should you remember these numericals? It is your wish. So this sulcus whichever I have drawn right now, you see this posterior ramus, right? So this posterior ramus is also called as lateral sulcus. The other name for lateral sulcus is Sylvian fissure. Okay, so this one over here is also called as lateral sulcus, or you can also call it as Sylvian fissure. Lateral sulcus, or you can also call it as Sylvian fissure. Okay, so once again, lateral sulcus or Sylvian fissure is there on the lateral side here. So all these 3 branches are coming from the stem of the lateral sulcus. So this stem gives rise into 3 branches. One is called anterior horizontal ramus, which is 2.5 centimeters, anterior ascending ramus, which is also 2.5 centimeters, and posterior ramus, which is 7 centimeters. Okay, so these are the structures which you can see over here. Clear? Right. Now after these, let us look at the real image. Now compare this image with this one. Now if you very clearly see here, can you see a sulcus that is going on to the back, which is exactly in the same position like this, you see? So this, can I call it as a lateral sulcus or a Sylvian fissure? And here within this, I have got 3 branches. See, this yellow color line which I have drawn is already one branch, right? That is called as your posterior ramus. Then where about anterior as well as ascending? See, you see a branch that is coming like this. This is anterior. You see a branch that is going up. This is ascending. Again, I am rubbing it out. Just concentrate on those lines. You see there is a line like this, right? So can I call it as anterior horizontal branch? You see, this is your anterior horizontal, and you can also see a branch that is going up in this way, right? So can I call this as an anterior ascending branch? And obviously this is your posterior branch. So this is your posterior, this is your ascending branch, this is your horizontal branch. Clear all of you? So this is what is called as your Sylvian fissure. Sylvian fissure. or you can also call it as a lateral sulcus, Sylvian fissure, or you can call it as a lateral sulcus. Okay. Now, once the lateral sulcus is done, are there any more sulcus? There are a lot of sulci. So, we shall discuss what are these sulci over here. Again, let us draw the same picture over here and let us discuss the sulci. So, all of you, I hope now you are aware of this picture over here like this, right? Right. Now, in this picture, what is this line? Now, I will be drawing it with the blue here. What is this line which I am drawing it with blue in this way? So, this is your posterior rami, or also called as lateral sulci, or you can also lateral sulcus, or you can also call it as Sylvian fissure. Now, I am drawing one more line exactly in the center like this. Okay. So, this line over here is called as a central sulcus. So, what is the line that is present in the center? You can call this as the central sulcus. Central sulcus. Okay. Or you can also call it as fissure of Rolando. Fissure of Rolando. Fissure of Rolando or central sulci. Okay. Now, actually, where is this going? See, for example, let me draw one more picture over here. See, this is your lateral surface, right? So, this is the front part, this is the back. So, exactly in the center, that the line which I am, the finger, exactly look at my finger, which is present horizontally, which is present vertically in the center. So, this finger is representing your central sulcus. Clear, all of you? So, this is a picture which you can see here, right? Now, what I am doing is that this central sulcus is passing on to the top like this. But can you see here on the top? No. Actually, you can exactly see only the lateral wave. You don't know what is happening on the top. You don't know what is happening on my side also. So, what I am telling you right now, is that this is your brain. This is your brain. Okay. So, if this is your brain, just imagine that there is these knuckles, whatever I have, this is a central sulci. Okay. So, this is the brain and this is the central sulci. Now, I can divide the brain into two hemispheres like this. Yes or no? So, this surface which you can see is the lateral side. This surface which you can see is the lateral side. This surface which you can see is the anterior, and this part facing towards me is the posterior. So, now anterior side is that side. Lateral side is projecting towards you. Now, what I am doing is that I am dividing both the cerebral hemispheres like this. See, I am dividing both the cerebral hemispheres. Once I have divided both the cerebral hemispheres, what is this side called as? This side previously which was closed inside, you see, it is closed inside. What is this side called as? This is called as your medial surface. Okay. Now, let me draw that medial surface over here. And this medial surface is having a structure like this. This is called as corpus callosum. Okay, so this structure over here is called as your corpus callosum. Where was your central sulci? So, where was your central sulcus? This is the place of your central sulcus, right? So, now pay attention clearly whatever I am discussing right now. So, this surface is your lateral. We also call it a superior lateral surface, and this surface is your medial surface. Medial surface. Okay. Now, look carefully whatever I am trying to explain you. For example, now look clearly whatever I am trying to explain you. For example, let us say this is your cerebral hemisphere, right? Now, this is the lateral surface, right? This is also the lateral surface, right? For example, if I am cutting down the cerebral hemispheres and I am opening it up, this is the medial surface of the cerebral hemisphere. Okay. Now, what I am doing is that there is a fissure like this, right? There is a sulcus that is going all the way like this, which is exactly in the center. You call it as central sulci, right? So, this central sulcus is going like this. It is going onto the back. It is folding onto the back, and where it is going, right? It is going onto the other side. No, there is no central sulci on the other side. But where is this central sulci going? If you can see here, this central sulcus is present on the medial side. Okay, it is not going like this on to the other side of the other lateral side. It is exactly going on to the medial side. You can see here, right? So, this is the central sulcus that is going up anteriorly upward, and then it is looping or it is folding back into the cerebral hemisphere onto the medial side. So, if this is the lateral side, see, it is going up all the way, going up, and finally it is folding, and this central sulci will fold like this and it will come in this way like this. You see, it is coming in this way. Clear? Now, this entire central sulci, which is on the lateral side as well as on the medial side, right? So, if you look here, this is around 8 to 10 centimeters. Okay, this central sulci is around 8 to 10 centimeters. So, most of you think only this is 8 to 10 centimeters. No, the entire central sulci on the middle and the lateral side together, it is 8 to 10 centimeters. And next important thing is that I have already discussed that there is a sulci here all the way, right? So what is this sulci called as? This sulcus is called as parieto-occipital sulcus. Why? Because this is the parietal side, this is the occipital lobe, and in between both the lobes you have got this sulcus. So you call it as parieto-occipital sulcus. Now, is this parieto-occipital sulcus, is it finished? No. Actually, what is happening? Parieto-occipital sulcus is also going. For example, if this is the structure over here, right? So, here you have got central sulci that is going and it is completely looping, right? It is folding back into the medial surface. In the same way here, what is the thing we have got? Here we have got parieto-occipital sulci. So, this parieto-occipital sulci also will go like this, you see. This parieto-occipital sulcus is also going like this. It is also making a fold onto the medial side. So when I am opening it and showing it to you, you can see a fold of parietal sulci on the parieto-occipital sulci on the medial side, right? So it means this is going up all the way. This is going up all the way, going up, and it is making a turn onto the back, and it is gonna come onto the medial surface in this way. Medial surface in this way. You see, so this is also your parieto-occipital sulcus, or you can also call it as calcarine sulcus. Parieto-occipital sulcus, or you can also call it as calcarine sulcus, right? So parieto-occipital sulcus or calcarine sulcus. And by the way, what is this notch called as? Again, what is this notch called as? So this notch over here is present in front of the occipital lobe. So you call it as pre-occipital notch. Pre-occipital notch. I think I have already told you that it is with the help of this central sulcus. If just below the central sulcus, for example, if I am drawing a dotted line that is touching your lateral sulcus, exactly speaking, is it lateral sulcus? No, exactly speaking, this is the posterior ramus of the lateral sulcus. Okay, so if I am drawing a line there, so this entire thing will become your frontal lobe. In the same way, for example, if I am drawing an imaginary line all the way from the parieto-occipital sulcus, you know what is the other name for parieto-occipital sulcus? Calcarine sulcus. So if I am drawing all the way a line from the parieto-occipital sulcus touching your what? Pre-occipital notch, and another line perpendicularly like this going and touching your posterior ramus of your lateral sulcus or Sylvian fissure. So here I can see some more lobes. So this lobe I have already mentioned parietal, this is occipital, and this is your temporal lobe, right? So these are the 4 lobes over here. Now the same picture, what we shall do is that we shall put the same picture back again, and then we shall discuss what are the other sulci as well as what are the other gyri we have got over here. Okay, so let us put up the same picture over here again, and then let us discuss what are the sulci and the gyri which we have got over here. Right, first I have to draw is the posterior sulci. So this is your posterior sulci, posterior sulcus, right? Posterior ramus of which sulcus? Lateral sulcus. Next important sulcus I have to draw is, I already told you there is a sulcus exactly in the center here. What is this sulcus called as? This sulcus is called as your central sulcus, and this is a picture from the lateral wave, not from the medial side. Okay, so this is called as your central sulcus. Now what I am telling you is that in front of the central sulcus, if I am drawing a line, in front of the central sulcus, first of all let me write it down. that this is your central sulcus. Okay, so let us say that this one is your central sulcus. In front of the central sulcus, if I am drawing a line, so can I call this as precentral sulcus? Yes, this one is called as precentral sulcus. Precentral sulcus. In the same way, for example, if I am drawing a line behind the central sulcus, then what this line is called as? This is called as postcentral sulcus. Okay, so what is this called as? This one is called as postcentral sulcus. Okay, so here we have got three important sulcus. One is called as a we have got three important sulcus. One is called as a central sulcus, another one is called as a precentral sulcus, another one is called as a postcentral sulcus. Now in between the sulcus, in between the sulci, whatever space you have got, that is called as gyrus. In between the sulci, whatever space you have got, this is called as a gyrus. Okay, we shall discuss about the gyrus in a minute. But before that, let us finish up all the sulci. So I hope you are all clear with all the sulci over here. The next sulcus which we shall be drawing is, see here I am drawing one more line like this in the frontal lobe. I am drawing another line also in the frontal lobe like, okay, and by the way, not to forget at all, that here I have told you that one ramus goes anteriorly forward, one ramus goes superiorly on the top, and one ramus is ascending up and one ramus is going posteriorly. This thing I have already discussed, right? Now let us leave this thing here. What is this two red lines which you have drawn horizontally? What are these two red lines which you have drawn horizontally are? See, this one over here which you can see, this one over here which you can see, this is superior, and the other one which I have drawn here is called as inferior. So what is this superior? This is called as superior, and this sulcus is located in the frontal lobe. So superior frontal sulcus. Okay, if that is superior frontal sulcus, then the lower one will become inferior frontal sulcus. One is superior frontal sulcus, another one is your inferior frontal sulcus. Next, let us enter into the temporal lobe. Now in the temporal lobe also, you have got two important sulcus. See, there is one sulcus going all the way like this, and there is another sulcus that is just behind it. Okay, now you will name what are the names of this sulcus. What is the name of this sulcus over here, and what is the name of this sulcus over here? So the top one should obviously, it should be called as superior. So this is called as superior temporal sulcus because it is present in the temporal lobe. Superior temporal sulcus. Next, the next sulcus which we have here is that we have got inferior temporal sulcus. Superior temporal sulcus, inferior temporal sulcus. Okay, right. Next important thing is that here if I draw a line like this in the parietal lobe, all of you know that this entire lobe is called as a parietal lobe. In the center of the parietal lobe, if I am drawing a line, can I call it as intraparietal sulcus? Because I have drawn exactly, this line is passing exactly in the center of your parietal lobe. So this line over here is called as intraparietal sulcus, right? So what is this sulcus over here? This sulcus over here, I can call it as intraparietal sulcus. Intraparietal sulcus. Now intraparietal sulcus is dividing the parietal lobes into two parts, right? One part is on the top, one part is on the bottom. So what are these two parts? Again, these two parts we will discuss in a minute. Next important sulcus which you should never forget is, here I have got a sulcus that is called as calcarine sulcus, or also called as parieto-occipital sulcus, right? Which is dividing the parietal lobe from the occipital lobe. And I also told you that you have to draw some lines. So this is a line that is going all the way and touching which notch? This is called as preoptic notch. In the same way, there is another line like this. right? I cannot draw that line here, I don't want to disturb the picture, but I just want you to know that we have drawn a line dividing it into the two lobes, and I'm not writing I'm not even writing that this is a parieto-occipital sulcus, because previously already we have discussed sufficiently what is this. Okay, now let us look at these structures over here. Now what is this area called as? See, this area which I am highlighting right now, what are these two areas called? Yeah, so I will write the abbreviated form. Just look at this. So one is located, one area is located in front of the central sulcus. So what did I tell you? Between the sulci, if you have an open area, that area you call it as gyrus. So what is this gyrus? Gyrus which is located in front is called as front of what? The central sulcus. So can I call this gyrus as precentral gyrus, right? So this is called as precentral gyrus. If this is precentral gyrus, the back one should be called as postcentral gyrus. One is called precentral gyrus, another one is called as postcentral gyrus. Now after that we have got few important gyrus over here. See, this is one gyrus over here. Next we have got another gyrus over here in the second part, and we have even got another gyrus over here also, like this. Okay, so what are these gyri over here? First important thing is that this gyrus, right, see this mark which I have done here, this gyrus is located where? It is located above the superior frontal sulcus. So this is called as superior frontal gyrus. So this is called as superior frontal gyrus. Just below that, what is the gyrus name? This is called as middle frontal gyrus. And just below that, what is the name of the gyrus? This is called as inferior frontal gyrus. Right, you can see here, one is called as superior frontal gyrus, this is called as middle frontal gyrus, and this is called as inferior frontal gyrus. The same thing will apply for your temporal lobe also. So in the temporal lobe also, you have got three important gyri, right? So this is one gyri which you have got, this is the second gyri which you have got over here, and this is the third important gyri which you have got over here. So now you will tell me what are the names of this. One is called as superior temporal gyrus, middle temporal gyrus, and inferior temporal gyrus. So superior temporal gyrus, middle temporal gyrus, inferior temporal gyrus. So these are the three gyruses which you can see here. Okay, next, what is this here? We have got intraparietal. We have got something called as, what is this? This is called as intraparietal sulcus. So intraparietal sulcus is dividing the parietal lobe into two other gyri. One gyri which I have drawn on the top. Now I am drawing another gyri which is located on the bottom like this. Okay, so there are two gyri. So what are these two gyri? So one gyri is located above the parietal lobe. So I have to call it as superior parietal gyri. One gyrus is located below the below the intraparietal sulcus. I have to call it as inferior parietal gyrus. Superior parietal gyrus, inferior parietal gyrus. Clear? So I hope till here the gyruses discussion is done. Okay. Now next important and next tricky part which you need to know is that, see, for example, if I am drawing something surrounding the central sulcus. So this blue color one is central sulcus. Now surrounding the central sulcus, this blue color U-shaped region which I am drawing right now. You see this U-shaped region which I am drawing right now exactly behind, right? This U-shaped region is completely enveloping your central sulcus over here. Now this gyrus here, you call it as, this is in the form of an arch, right? So you call this gyrus as arched gyrus. What is this gyrus called? This gyrus over here is called as an arched gyrus. So this gyrus over here is called as arched gyrus. Arched gyrus. Where is arched gyrus? Arched gyrus is a U-shaped gyrus that is completely enveloping the lower part of central sulcus. Right? So it is enveloping completely, or it is completely folding the lower part of the central sulcus. Next, you have got still more, 3 more U-shaped gyrus. Right. Next important thing, you have got 3 more U-shaped gyruses. So where are these 3 more U-shaped gyruses? See, here you have got one U-shaped gyrus like this. You see, there is one U-shaped gyrus over here. Okay, the blue one. And next, let us see another U-shaped gyrus over here with the rose pink. This is another U-shaped gyrus, and after that with the green I am drawing another U-shaped gyrus here. So one U-shaped gyrus is completely surrounding what? It is surrounding your lateral sulcus or Sylvian fissure. One U-shaped gyrus is completely surrounding your superior temporal sulcus, and another U-shaped is completely surrounding your inferior temporal sulcus. Okay, so what are these U-shaped gyruses? So this U-shaped gyrus which you can see over here, this is called as supramarginal gyrus. What is this called as? This is called as supramarginal gyrus. Okay, next, this gyrus over here is called as angular gyrus. This is called as angular gyrus. And next, the third and the last important gyrus over here is called as posterior parietal gyrus. Posterior parietal gyrus, or where is this gyrus exactly located, guys? This gyrus is exactly located in between. This is the temporal region, right? Not only temporal region, this is the occipital region. So between the temporal and occipital region you see this gyrus. So can I call it as temporo-occipital gyrus? Yeah, so this is also called as temporo-occipital gyrus. Temporo-occipital gyrus. So these are the 3 important gyrus which you have to basically know here. Okay, so I don't think so this is really that difficult to remember. So it will, if you just practice these things, it will be very easy to remember. Okay, right. Next important thing I want to tell you here is that if you can look here, there are 3 important spaces which you can see here. See, all of you see here, there is one yellow color space which I am drawing here. You see, where is this yellow color space? Can I tell that this yellow color space is located in the frontal lobe? Second important point, it is located below what is this line called as? This line is called as anterior horizontal ramus. So it is located below the anterior horizontal ramus, right? And next, there is another space which is present just above that. Now where is this space located? This space is also located in the frontal lobe, but it is located between the ascending ramus as well as the horizontal ramus. And third important thing is this space on the back, like this. Okay, so what are the 3 important things we have got? We have got an yellow color one. I'm just highlighting it. Just look here. I cannot disturb the picture here. One yellow color one, and I don't know what is this color. I think it is a cement color. And finally we have got one green color one. So what are these yellow dot, cement dot as well as the green dot which you have drawn? So all of you just pay attention to the thing over here. This yellow color one over here is called as pars orbitalis. What is this? This is called as pars orbitalis. Okay. Next important thing is called as pars triangularis. Pars triangularis. So one is called as pars orbitalis, next is called as pars triangularis, and third important thing is called as pars opercularis. Pars opercularis. So what are these 3 important things? One is called as pars orbitalis, pars triangularis as well as pars opercularis, right? So all these 3 important structures together, you call them as opercula. you call them as opercula, and you know this area has got a very important name, and that is called as Broca's area. Broca's area. Can anyone just comment down what is the one function of this Broca's area? This is a motor speech area. So what is this? This is a motor speech area. This is a motor speech area. Okay, so Broca's area is nothing but called as your motor speech area, right? I hope you understood all these things over here, right? So this yellow color one is pars orbitalis, next one is pars triangularis, and the green one is pars opercularis. Three of them together you called as opercula, and you know where are they located exactly, right? Now when we concentrate on the occipital lobe, in the occipital lobe, for example, in the occipital lobe, I am going to draw a line like this. Okay, so this line over here is called as calcarine sulcus. What is the name of the sulcus? This sulcus over here is called as calcarine sulcus. So this one over here is called as calcarine sulcus. Calcarine sulcus. Just above this calcarine sulcus, okay, just above this calcarine sulcus. So another sulcus in this way. Now this sulcus, isn't it in the form of a half moon shaped, right? So if anything which is in the form of a half moon, can I call it as a lunate sulcus, right? So this sulcus over here is called as the lunate sulcus. This sulcus over here is called as a lunate sulcus. Now above the lunate sulcus, I have got a cap like thing. Below the lunate sulcus also I have got a cap like thing. Now what is this structures that are located above the lunate sulcus and below the lunate sulcus? The thing which is located above is called as upper polar sulcus. See, this one over here is called as your upper polar sulcus, and this one over here is called as your lower polar sulcus. Upper polar sulcus, and this one over here is called as your lower polar sulcus. Okay, so what did we discuss? One is called as calcarine sulcus. Above the calcarine sulcus, a cap like thing which is half moon is called as lunate sulcus. The two ends of the lunate sulcus are protected by two caps. On the top you call it as upper polar sulcus, and the lower part is called as a lower polar sulcus. And finally here you have got one more sulcus in this way, which is transverse. So any sulcus which is transverse and located in the occipital area, can I call it as transverse occipital sulcus, right? So this sulcus over here, this sulcus over here like this is called as transverse occipital sulcus. Okay, this is called as transverse occipital sulcus. So what are the important things we have discussed so far, guys? We have started our discussion like this. We discussed that there is something called as the lateral sulcus, or you can also call it as a Sylvian fissure. You see, lateral sulcus, or you can call it as a Sylvian fissure. Now after this lateral sulcus and Sylvian fissure, we discussed that there is stem of the lateral sulcus which is divided into three. One is called as horizontal, another one is called as ascending ramus, another one is called as a posterior ramus. So posterior is 7 centimeters, remaining to a 2.5, right? And this is what I was telling you, that here you have got a structure called as opercula. What is that? We called it as orbicularis, and here we have got a structure called as triangularis, and here we have got a structure, this last structure over here is called as opercularis. All of them together is your Broca's area, right? So next important thing, this is the real image, and here I have already told you that the central sulcus or fissure of Rolando, it is around 8 to 10 centimeters, right? So this is the thing which I have already discussed, and you also know that there is something called calcarine sulcus or parieto-occipital sulcus. And here we have got central sulcus. In front of the central sulcus you call that sulcus as precentral sulcus, behind is called as postcentral sulcus. Okay, next we have got something called as superior frontal sulcus, inferior frontal sulcus. Next we have got something called as superior temporal sulcus, inferior temporal sulcus. Okay, and these three are very important. One is called as, what is this, supramarginal gyrus. Next we have got something called as angular gyrus. Next we have got posterior parietal gyrus. Okay, these are the three gyrus that are very important to know. right? So these are some of the very important structures which you need to know, guys. So thank you so much for watching my video. Goodbye.